Assalamualaikum students, I am Dr. Sabiha Jahan, lecturer of Anatomy Department, Delta Medical College. Today I am going to discuss about the viscera tongue. This is the viscera of tongue with larynx and pharynx. In the tongue, it has three parts: root, body and tip, and two surface. Upper surface or dorsum of the tongue and inferior surface. The dorsum of the tongue is divided into two parts. The anterior 2/3 is the oral part and posterior 1/3 is the pharyngeal part. In the anterior 2/3 there are some papilla. In the tip there is the fungiform papilla, and all over the tongue there is present in the filiform papilla, and in the lateral side the follate papilla is present, and in front of the sulcus terminalis the circumvallate papilla is present here. In the posterior 2/3 of the papilla there are, in the middle, this is the foramen cecum and this is the sulcus terminalis, and in the posterior 1/3 this is the lymphoid follicles, which is collectively known as lingual tonsil, and this is the palatopharyngeal pouch. Here palatine tonsil is present in both sides, and in the most posterior part of the tongue is called vallicula. Now come to the inferior surface. In the inferior surface there is a structure called frenulum, and there also the deep lingual vein is also present on both sides. Now come to the muscles of the tongue. Tongue has two types of muscle: intrinsic muscles and extrinsic muscles. Intrinsic muscles are superior longitudinal, inferior longitudinal, transverse and vertical muscle, and extrinsic muscles are genioglossus, hyoglossus, styloglossus and palatoglossus. And now come to the most important part, the nerve supply of the tongue. Nerve supply of the tongue: at first the motor supply. All the intrinsic and extrinsic muscle except the palatoglossus are supplied by the hypoglossal nerve. The palatoglossus muscle is supplied by the cranial root of the accessory nerve. And the sensory supply: the general sensation are in the anterior 2/3 is supplied by the lingual nerve, and posterior 1/3 is supplied by the glossopharyngeal nerve, and the most posterior part is supplied by the internal laryngeal branch of vagus nerve. And special sensation or taste sensation: the anterior 2/3, the special sensation are the chorda tympani, the branch of facial nerve, except the valate papilla, and the posterior 1/3 is supplied by glossopharyngeal nerve, and the most posterior part is supplied by internal laryngeal branch of the vagus nerve.